Good. So, you said you went to ER for the rib cage pain.
Yeah, about a few months ago, I have a disease called costocongitis, which is a muscle and an appendage that's right in the center of where the rib cage is. And when I used to play golf, the movement of swinging my arms puts the pressure of my rib cage pushing against that muscle, which causes pain in the center of my chest, and it radiates through my rib cage to the back. Now, I've had it before, and I usually know what it is, and I don't worry about it. But a couple of months ago, it was so bad that I was afraid I was having a heart attack, because many of the symptoms of this disease mimics a heart attack. Now, the doctor that I saw, when he verified that it was a costocongitis attack, but he said it's a good thing. Go to the hospital. Don't try and medically figure out what's going wrong. But he said if you didn't have any tingling or pain going down your left arm or shortness of breath, those would be, you have to look at other signs of a heart attack. So there's really not too much the medical field can do, but Lee has been very successful treating that ailment through acupuncture.
I think when you have that problems, the doctor recommend heat and a certain position when you sleep.
Right.
I mean,
don't cross my arms over and push. Yeah.
All of this, the heat and the position change will try to reduce the pressure here, meaning you want to relax those muscles here. But acupuncture will help you do the similar thing. So by insert needle locally, then you kind of relax the muscle, reduce the pressure here. That's number one. But acupuncture and herbs can also reduce the inflammation. This is inflammation, not infection. So
yeah, I do take the herbs for the inflammation. Yeah.
So the herbs can reduce the inflammation, and also the needles at certain point, like large intestine 11 and spleen 10, it speed up the circulation and also carries away the inflammatory chemicals. So once the inflammation goes away, the muscle relaxed, then it won't press the nerves, causing that excruciating pain.
Do you put the needles right in the muscle?
we can do follow the channels, like a spleen channel, stomach channel, and also we can do like palpitate the tender spot. And
I have some tender spots on the. Is this the lower rib, the first rib?
No, this is 5, 6, and 7. This is thoracic 7. So, so that's just like you said, when you play golf, you put pressure, your muscle tighten up. Yes. But
if I do gardening, there's many. I have to think about what I'm doing.
Yes.
And I usually get a little warning. I feel a little bit of pain, but this came on very sudden, and I don't really know what caused it. I can't remember.
I think that's
doing anything.
Is that right after your another surgery, the hip replacement, or before that? I think. No, not after that. I think after that.
After it.
Yeah, because your body went through so much, so your adrenal gland is kind of weak. When it's weak, and you tend to develop a higher level of inflammation, and probably you did something, strain the muscle, and that inflammation level can go up, causing that severe pain.
After my hip surgery, I've had so many surgeries, but after my third hip revision or left hip surgery, I was using a cane, and when I push down my weight on the cane, it goes up my arm, goes across my chest, and that activates it as well.
Yes, right. That's put pressure there. So continue your inflammation herbs, and because that inflammation herb also help the digestive issue. So when you taking the Manjaro once a week, you also want to absorb the nutrients. So that herbs reduce the inflammation, strengthen your digestive system.
Okay.
Thank
Well,
you.
I do feel a lot better since I've lost the weight. So
Yes,
I don't want to go back to where I was.
that's correct.
I'll give all my extra large shirts to Goodwill.